Are you someone suffering with tooth decay, gum abscess, pericoronitis, burning mouth syndrome to conditions like the oral lichen planus? These are conditions that occur all of a sudden. These are conditions that keep on recurring. Right from mouth ulcers to oral lichen planus, we see patients struggling on a day-to-day basis with these kinds of conditions. In this video, we're going to talk about a permanent solution, we're going to talk about a root cause, and we're going to talk about a classical Ayurvedic formulation which was explained years ago for such oral disorders, for such conditions, whether it is just related to the symptom of the oral cavity or the autoimmune conditions like the oral lichen planus. Let's talk about oral disorders and Ayurveda in this particular video. First everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. Oral disorders, although it is very common, it is important to understand the root cause. Sankshipta Kriya Yoge Nidan Parivarjan. The Nidan is very important. In Ayurveda there is a 3 sutra, Hetu Ling Aushad. Aushad, the treatment comes in the third phase. The second is a symptom and which comes from the Hetu, which is the cause. Is it excess consumption of spicy or sour items? Is it excessive, emotional stress? Is it the excessive anger or the mood swing or the aggressiveness? Is it excessive consumption of on and off medication? Because drug eruptions also increase the acidic tendency, which further leads to mouth ulcers. Many a times patients complain that I take an antibiotic, I get these problems. I have a spicy food, I get these items. I follow a normal lifestyle, but still I get these issues. I need to have recurrent medications for my mouth ulcer. Let me tell you, oral disorders, although doesn't seem to be a huge problem, it's important to diagnose it in the first place itself. At our several camps at Karzat, we see patients of oral disorder and we ask them, since when are you having this? So they often tell us it's been a lot of years. So we tell them you don't need to ignore this is oral lichen planus. And then we educate people in these seminars and the lectures that oral lichen planus is a serious condition and you need to make sure you treat it with the karma, certain point treatment, certain medications, certain guidelines. We advise them certain things and make sure they manage and they reverse their particular condition. So a tip over here, never ignore oral disorders. Make sure you at least take efforts to diagnose it. Patients we see using right from simple home remedies to glucocorticosteroid with minimal to major change, but the problem comes back again. It's very important to dive into the depth of the core, the root cause, and accordingly work on it. Nevertheless, I'm going to talk about a classical preparation explained years ago, available across the globe of various companies, so you can use it and you see a lot of wounds and a burning and all the itching and all the white scales and the lesions and the mouth ulcers getting better from the first week of its use itself. So again, this comes from the Ashtang Hriday Uttar Sthan 22nd chapter from 90th to 96th verse. This is a beautiful explanation in Sanskrit. This medicine is the Iri Medadi Tel. Iri Medadi Tel is a combination of most of the Pitta Shamana Dravyas, right from Garik, which is the red ochre, to Yashti Madhu, to Triphala, to Shweta Chandan, Rakta Chandan, and many of the Pitta Shamana Dravya, which is Iri Medadi Tel. It is generally advised that one must use this oil for an external use, which is in the form of oil pulling. A minimum time is explained 5 minutes to a good period of 15-20 minutes will give good results when it comes to recurrent and relapsing oral disorders. This oil, as it is Pitta Shamana, it is also applied over the head area as well for a cooling effect. Again, Iri Medadi Tel for all the Paitic Vikar, for all the oral lichen planus, burning mouth syndrome, tooth decay, gum abscess. This is a beautiful medicine. So on a daily basis, before the food, you must do a gandush or a kaval. Either you gargle or you hold for 10 to 15 minutes on a daily basis to reap all the benefit that this offers. A minimum once a day, a minimum of 5 minutes. So Iri Medadi Tel is a really useful one which was explained years ago in Ashtang Hriday. So in the Sahasra Yoga, Taila Yoga Prakraran, beautiful explanation and importance given to Iri Medadi Tel. So this is a general one that will help one and all. Make sure you choose Ayurveda, you choose wisely, and you understand the root cause of your condition and work on it. This is all for now. Any doubts, questions, I'd be happy to hear from you, from Jyovis and the team. Look impressive, be progressive.